Is travel nursing still worth it in 2025? With the healthcare industry still recovering from post-pandemic shifts, rising inflation, and nurse shortages in certain regions, the answer isn't as straightforward as it used to be. So let's break it down. But first, welcome to Travel Wisdom. Don't forget to like and subscribe. Thinking of trying it? Or already traveling in 2025? Drop your thoughts below. I'd love to hear what you're seeing out there. Also, check out the links in the description. Now let's get started. One of the biggest reasons travel nursing is still popular in 2025 is pay. After a dip in rates in late 2023 and early 2024, many facilities have had to raise travel nurse pay again to compete with burnout and high turnover. While it's not at pandemic-era highs, travel nurses are still earning significantly more than many staff roles, especially in critical care, ER, and labor and delivery. Plus, inflation and rising living costs in the U.S. mean making more per hour has become more important than ever. For nurses looking to save money, pay off debt, or avoid taking on multiple staff shifts, travel nursing is still one of the fastest ways to build up savings. Flexibility is also more valued in 2025. The traditional 9-to-5, 40-hour week is being questioned across many industries. Travel nursing fits perfectly into this shift. You can take breaks between contracts, move to lower-cost cities, or follow seasonal demand to maximize income. And speaking of location, remote and underserved areas are offering major incentives in 2025. Think big sign-on bonuses, housing stipends, or even help with licensing. If you're willing to go rural or work in a hard-to-staff hospital, your earnings can really add up. But let's be real. 2025 also brings new challenges for travel nurses. First, some hospitals are tightening their budgets. After years of high travel staffing costs, some facilities are shifting back to hiring more permanent nurses, which means fewer contracts in certain cities. This doesn't mean travel jobs are gone. It just means you have to be more strategic about which contracts you take and where. Also, AI and tech tools are being used more often in hospital scheduling. That means you might get floated to different units more often, and it can sometimes feel like you're filling in everywhere. If you thrive on routine, this could get frustrating. Licensing has gotten both easier and trickier. Thanks to more states joining the Nurse Licensure Compact, NLC, multi-state licenses help you move around faster. But not all states are on board. So depending on where you want to go, paperwork delays can still be a headache. Lastly, tax rules for travel nurses are getting stricter. In 2025, agencies and the IRS are paying closer attention to tax homes, stipends, and deductions. It's more important than ever to know the rules, keep your records clean, and maybe even talk to a tax pro. So is travel nursing worth it in 2025? If you're flexible, financially motivated, and comfortable with constant change, yes, definitely. There are still high-paying contracts, housing stipends, and huge demand in specific areas. It's one of the fastest ways to build your savings, gain experience, and explore the country. But if you're looking for stability, long-term benefits, and predictable work conditions, you might want to pause or consider travel nursing part-time between more stable jobs. Bottom line, travel nursing in 2025 can still be an amazing opportunity. If you're thinking about taking the leap, do your research, ask other nurses about their experiences this year, and always read the fine print in your contracts. Thinking of trying it? Or already traveling in 2025? Drop your thoughts below. I'd love to hear what you're seeing out there. Don't forget to like and subscribe. Also, check out the links in the description. Thank you so much for watching. See you in the next video. Bye.